Having come and gone, the House Healthcare Licensing Committee shall come to order. We have two replacement letters from Speaker Welch, replacing permanent member LaPointe with temporary member Lisa Davis and permanent member Jaharia Williams with temporary member Mike Crawford. With that, clerk, please take the roll.
Morgan.
Here.
Ma. Howder. Here. Chung. Here. Della Rosa. Jacobs.
Here.
Manley. Here. Moyler. Here. Moore. Here. Ortiz. Here. Ryan. Here. Schmidt. Tipsworth. Here. Crawford. Here. Davis. Here. That gives you 12 members.
And then what's the partisan? With 12 members present, we have a quorum. Good morning again, everyone. And if you were here for our excitement last week, you know that this committee is efficient and we move fast and we do good work. We have another full committee this week, as well as being deadline week. It won't surprise me, nor should it surprise you, if we have to have a second committee hearing this week. We will get as far as we can, but we will not be delaying sessions. So that gives us just over an hour and a half to get through roughly 15 bills. We're going to, as usual, we will not be necessarily going in order as people are coming in and out. We're going to be calling, actually 14. We have House Bill 4913, House Bill, nope, I'm wrong, 13. See, by the second, we're losing bills. We have House Bill 4913, House Bill 5046, House Bill 5411, 5225, 4698, 4977, 3460, 4982, 5387, House Floor Amendment 2 to 4826, House Floor Number 4 to House Bill 1076, and House Floor Amendment 2 to House Bill 4953. Again, we're not going to be going in order. For those of you who are presenting bills that are going to be held on second, we're going to ask you to be really specific. We're going to talk about why you're holding on second, how you're going to get to a place where you, if ideally, are removing opposition or moving it to a place where this committee can favorably report it to the floor and not hold it on second. All right, we're going to jump in. We're going to start with Representative Crawford with House Bill 3460. Mr. Crawford, thanks for subbing in, and whenever you're ready, please proceed.
Thank you, Chair Morgan. Let me adjust that. Thank you, Chair Morgan and members of the committee. First, I'd like to announce I will be holding this on second. We have a bill, an amendment to this bill that's been heavily negotiated that we want to make sure gets out there. But I'll give you the gist and give you the gist of the amendment as well. House Bill 3460 creates a modern structured apprenticeship pathway for individuals seeking licensure in cosmetology, barbery and aesthetics, estheticians, nail technology, and hair braiding. Right now, the primary pathways to these professions is through traditional schooling, often requiring significant upfront cost. This bill offers an additional option, an earn while you learn model, where individuals can gain real supervised experience in a licensed salon or shop while being paid at least the minimum wage. The bill sets clear guardrails. Apprentices must be supervised by an experienced licensed professional in good standing. Programs must meet state standards, and all participants remain subject to state licensure exams. This is not a shortcut. It is a different pathway to the same professional standard. Importantly, this legislation also expands access. It creates opportunities for individuals who may not be able to afford traditional programs and ensures that even those who are incarcerated can pursue licensure and reentry into the workforce. At its core, this bill strengthens our workforce pipeline, supports small businesses, and removes unnecessary barriers to good-paying licensed careers. This bill, as I said, this bill has been heavily negotiated over the past year. We've had extensive discussions with multiple stakeholders and have incorporated much of their feedback into the forthcoming amendment language. I'd like to thank personally thank the Illinois Association of Cosmetology Schools and IDFPR for their engagement and thoughtful suggestions throughout this process. Thank you for letting me earn your support. For that reason, I'm asking the committee to hold this bill on second while we finalize the negotiated amendment. The amendment will simply adjust the required training hours, 3,000 hours for cosmetology and barbering, 1,500 hours for estheticians, 700 for nail technicians, and 600 for hair braiders, and ensures that oversight of these programs remains here with the state of Illinois under the purview of IDFPR. I promise to bring this bill back to committee once those final details are complete. And we are here to answer any questions and offer testimony.
Thank you, Representative Crawford. And if you'll just give us a second, I'm in receipt of a temporary replacement letter from Leader McCombie replacing permanent member Schmidt with temporary member Jackie Haas. So, Clerk, I think that gets us to 13 members present?
12.
Still 12? We have 12 members present. And also, it's important to note that this committee has really, again, emphasized those that do the work. And Representative Crawford, you had this bill last year. You've continued to work on it. I want to thank you for doing that good work. And those opponents who've worked with you, again, this committee rewards those who do the work and find ways to resolve conflict and opposition. Reading witness slips, we have 25 proponents, a slew of individuals, including the Small Business Advisory Council, Illinois Policy Institute, and some individual associations, as well as 9 opponents, including Fusion Beauty Academy, Next Level School of Cosmetology Arts, Chicago Cosmetologists Association, and 1 no position from Connor Norris on behalf of Knee Regulatory Research Center. Mr. Crawford, did your witnesses have any brief testimony or just here to answer questions?
They do have brief testimony.
All right, brief, please. Thank you.
Thank you so much. I will pull up my notes so I don't go off script. Thank you, Chair Morgan and committee members. I'm Elizabeth Struess. I'm a salon owner. I'm a hairstylist. I'm a massage therapist, and I own a tattoo company. I only share all of that because it means I'm very well aware of licensure in the state of Illinois, as I hold 4 of them. I got home from the Navy to a GI Bill to get my license. As a cosmetologist, that should have been easy because I had the GI Bill and I had FAFSA. What that really meant is I worked overnights at McDonald's and had to sleep on the benches before I went to school, because being from Murfreesboro, Illinois means that you drive 30 to 40 minutes to go to school. So I could not afford to drive from work to home to make it back to school. So I, as a veteran, should have had the easiest path to go to school. Allowing this apprenticeship allows us to bridge a gap. I think schools are a great, straightforward way to school. I just don't think that it allows us the only way, and I think this allows us as a small business owner a way that I can pull people in and I can take care of them in my own community. The last time I was here, I heard a term called a medical desert, and I'd like to offer that we are in an education desert. 1 school 30 minutes from my business is not enough to support the amount of hires we need. That school supports 5 counties, which means that we would have to have almost 500 people available for those 100 salons in each county, and they only graduate 25. So apprenticeships would allow us a much larger workforce to pull from, while also allowing us to employ people. And as a small business owner, that's how I make the greatest amount of change. So if we care about small businesses, and we care about workforce development, and we care about equity and access to licensed professions, then we need more than 1 doorway to this industry. And I'm here today because I believe no one else should have to sleep on a set of chairs just to be able to get in. Thank you.
Thank you so much. Questions and discussion from committee? Spokesman Howder.
Thank you, Chair. Rep, is there any other, maybe IDFPR knows this, but is there any other licensed profession in Illinois that does not go to school? With this bill, they'd be allowed to go through an apprenticeship program and not go to school. Is there any other profession that's licensed by the state that can do that?
I would defer to IDFPR.
Dan Lewis, IDFPR. I think that auctioneers maybe don't have to get, or maybe they don't have to pass an examination, or sorry, they do have to pass an examination. They don't need a specific education, but that's the only thing I can think of off the top of my head.
So of all the licenses that you do, maybe only one other has an apprenticeship track.
Yeah, maybe Noah, you can speak more to the hours requirement that you're looking at and thinking about training in lieu of the traditional education.
Yeah. Thank you kindly.
So, Dan, just have one more. Okay.
We understand what you're saying.
Why don't you introduce yourself real quick? Go
Yeah,
ahead.
absolutely. My name is Noah Bezos. I'm the legislative strategist for the IJ Clinic on Entrepreneurship. We're a legal clinic out of Chicago Law School, and we work to make small business ownership and entrepreneurship cheaper, faster, and simpler. So one thing that's important to note about this bill is that each of these occupations, the on-the-job training hours would be double what the state minimums are. And again, as we said previously, each person that would go through this apprenticeship program would ultimately still need to take the state licensure exam in order to be qualified as a cosmetologist, esthetician, or any of these other programs. There are already all sorts of different apprenticeship programs for all sorts of different jobs operating in Illinois, but from a regulatory standpoint, from a public safety standpoint, and an education standpoint, we feel like this bill ultimately covers a lot of those issues because folks are ultimately doing more time than they would otherwise be doing if they went to a cosmetology school.
I appreciate that. I'm just pointing out that it's very unique to have a licensed profession that doesn't attend any schooling at all. And usually that's kind of how you get credentialed and licensed. So
They are receiving so I'm an educator, workforce educator in higher ed as well. And so, I mean, school, you're talking about the structure, a place that they go, a building. They're receiving an education, which is very important to point out. So though it may not be formal schooling, your class is at this time, and this is what this class is covering. And it's set up like a classroom, whatever. They are learning on the job, and they will be covering all the outcomes and expectations that you would get in school as part of their apprenticeship. It's a requirement. We're not changing anything. The goal is to get these individuals to pass their test. Not just to pass it, but to have all of the competencies, the understanding of what anyone would get in the school in order to become licensed professionals in Illinois.
okay. Well, I appreciate that you're bringing this back, and I'm hearing that IDFPR is opposed. They remain opposed until we.
We have negotiated the amendment with IDFPR that should remove their
Okay, so
opposition.
that's what the second will do.
Let's have them.
Yep.
And then the schools, I assume, are opposed.
Yeah, Dan Lewis again, IDFPR. Yes, we're still opposed to the bill as it's currently written, working collaboratively on the amendment. Right now, I think they're waiting for some feedback from us on the latest draft. So we're working on that, going to send it forward and keep working collaboratively to try to address our opposition.
And I can also say that from the perspective of the Illinois Cosmetology School Association, those folks are very close to an agreement. We're actually working with their attorney right now just on some technical cleanup, moving around some clauses, things along those lines, more technically related with the schools, because their primary issue was making sure that we had an adequate number of hours, and we were able to meet them on that by doubling the hours that's required from cosmetology school.
Okay, I didn't catch that. So they are opposed, but they've worked with you.
They've been working with us. We've addressed their most pressing concern, but as of right now, we're just we spoke with them yesterday, and they asked us to do some technical cleanup in terms of just tightening up some definitions, things along those lines.
Absolutely. Okay.
Thank you, spokesman. Any further discussion or debate? There being none, Representative Ortiz moves that House Bill 3460 do pass. Is there leave?
We're going to do partisan leave until we see the second.
Thank you, spokesman. With partisan leave, we have 8 votes in favor, 5 voting opposed, and 0 voting present. House Bill 3460 is declared passed and will be favorably reported to the House floor. Thank you, Representative.
Thank you, Chair and Committee.
Thank you.
We will move on to Leader Haas with House Bill 4982. Leader, whenever you're ready.
Thank you, Chair. Permission to present from my seat?
Granted.
Thank you. Thank you, Chairman Morgan and Spokesperson Howder. I'm here today to present House Bill 4982. This idea was brought to me by a constituent who's also a local representative for the American Foundation for Suicide prevention. This idea is to make every effort to get the information about the 988 Suicide and Crisis Lifeline number in the hands of as many people as possible. And the constituents' idea was so many folks are going to the pharmacy to pick up medications that this could be done by having information about the 988 hotline available at pharmacies. So this bill would provide that every licensed pharmacy would directly serving patients at a physical location shall conspicuously post a sign provided by the Department of Human Services that contains information about the 988 Suicide and Crisis Lifeline and other information that the Department of Human Services deems appropriate. We are working on an amendment with DHS and the Pharmacy Association. Neither of them are in opposition, but we do think that we can make this bill a little bit better. So I'm asking that we get this through committee, but I'm happy to bring it back with the amendment. DHS is asking for a language change in this because they don't actually run the hotline. They don't operate it. So they are an oversight agency. So we'll make a little language change in there that DHS makes the Suicide and Crisis Lifeline available. And the Pharmacy Association is actually suggesting that the sign add some additional information about some resources that are available as well. So expanding that information that would be available to consumers as well. So we'll be working on that amendment. And like I said, I would be glad to hold it on second and bring it back to the committee.
Thank you, Leader Haas. Let's add Vice Chair Ma to the roll, please, Clerk. And just reading witness slips, we have one proponent, Stephen Moore, on behalf of the American Foundation for Society Prevention, and one no position, which I believe is Dan Lewis on behalf of IDFPR. And Leader Haas, thank you for describing the recommendations. Again, nobody slipped in opposition, but another example of where there are ways to improve this bill. We have a commitment from the sponsor to hold it on second, bring it back to remove any of those concerns. Without any further discussion or questions of the committee. There being no further debate, Representative Moore moves that House Bill 4982 do pass. Spokesman, is there leave?
Leave.
Thank you. With leave, there being 14 votes in favor, 0 voting opposed, and 0 voting present. House Bill 4982 is declared passed and will be favorably reported to the House floor. Thank you, Leader. We look forward to seeing this bill when it comes back with an amendment.
Thank you, Chairman.
We will move on to Representative Lisa Davis for House Bill 4913.
Good morning, Mr. Chair.
Representative, you're going to be adopting the amendment?
Yes,
All
please.
right. With that, we have Vice Chair Ma moves that the committee do adopt House Committee Amendment Number 1, House Bill 4913. All those in favor say aye, opposed say nay. In the opinion of the chair, the ayes have it, and the amendment is adopted. Representative, go ahead.
So let me just lead by saying that we are asking to hold this on second. Conversations are still ongoing, and we are hoping to come back with an amendment. So let me just let you guys know, with the amendment that was just adopted, that does bring IDFPR's position to neutral. And what House Bill 4913 would allow dental hygienists and community health centers to administer local anesthetics if, one, they have completed a training program approved by IDFPR, 2, a dentist has first assessed the patient and ordered the local anesthesia, 3, a dentist or physician is physically present during the administration, and 4, by then the center has adopted written policies and procedures establishing supervision protocols. So number 3 is where conversations are still ongoing. I'm happy to present my witness, Cyrus Renette, for any questions or testimony.
And Cyrus, before you go ahead, we have 2 proponents on the amendment, Cyrus on behalf of Community Health Centers and Jan Starr on behalf of Illinois Dental Hygienists Association. 2 opponents, both on behalf of the Illinois State Dental Society, Greg Cox and Lindsay Wagahoff, and 1 low position from Dan Lewis on behalf of IDFPR. With that, Mr. Winnett, please go ahead.
I'm happy to answer any questions if anybody has any.
All right. Thank you for that. Questions and discussions from the committee? Spokesman Howder.
Thank you, Chair. So just inform me now, so the dentists are opposed, but you have in here wording that a physician can be present or has to be present.
Yes, Representative, thank you for the question. At community health centers, commonly referred to as FQHCs, we have dental providers, behavioral health providers, and medical providers all working in the same physical location. So in an effort to expand access to care in what we thought was a reasonable and safe and efficient manner, would still require the dentist to examine the patient, diagnose the need for a deep cleaning with local anesthetics, and then order that procedure. But if they are unable to be there physically present in the day, which happens too often, hence the bill, we would allow that service to continue with a dentist, or a dentist or a physician being physically present. And also, many of the dentists who I work for at our association have shared that it is commonplace for the medical staff to actually be the staff who are responding in the event that there is an adverse reaction. But that is the core of the opposition and the core of our discussions.
But I thought that a physician could delegate if local anesthetic injection to whoever was trained to do it. They could delegate it to a nurse or a. Is that not correct?
So I would just note that the medical society who you spoke to does not have any concerns with this bill. Neither does the Illinois Department of Professional Regulation. They do not have safety concerns and see this as a good access to care bill.
Okay. Well, I mean, we're going to oppose it until we see the second because of the dentist's opposition. But I'm just a little bit curious why a physician would not be allowed to delegate that if he so chose.
All right, thank you, Spokesman. Further questions or discussions from committee? With the understanding that more work is to be done, again, this committee is recognizing that work has been done. I want to thank the proponents and opponents working on this and the commitment that this only will move forward. It's going to be held on second if there's an agreement with the Dental Society. With that, being over for the debate, Representative Manley moves that House Bill 4913 do pass as amended. Is there leave?
Partisan leave.
Thank you, Spokesman. With partisan leave. 9 votes in favor, 5 voting opposed, and 0 voting present. House Bill 4913 is declared passed as amended and will be favorably reported to the House floor. Thanks, Representative. We are going to move to Representative Manley for House Bill 5225 for House Committee Amendment number 1. Representative Manley, as you get settled, we're going to be adopting the amendment. All right. So with that, we have Representative Ortiz moves that the committee do adopt House Committee Amendment number 1 to House Bill 5225. All those in favor say aye, opposed say nay. In the opinion of the chair, the ayes have it, and the amendment is adopted. Representative Manley, whenever you're ready, please proceed.
Thank you, Mr. Chairman. Members of the committee, I'm here with House Bill 5225. I would say it's my passion project, which I never use that word very often. This bill amends the Speech, Language, Pathology, and Audiology Practice Act, allowing SLPs to diagnose autism spectrum disorders if a child is under 3 years of age, and the speech language pathologist, SLP, has been correctly trained. Makes conforming changes in the medical assistance article of the Illinois Public Aid Code and provisions of the Illinois Insurance Code concerning autism spectrum disorders. I have with me somebody I've grown to admire immensely. I can't remember your last name, Meg. Meg Roberts, who's done an incredible amount. She's done an incredible bit of research that has led us to this point, and also Jonathan Doster from Start Early. We'll take any questions.
And thank you, Representative Manley. And forgive me, I was going so fast that I misspoke on the committee amendment adoption. So we're going to do that over quickly, but we're going to do it over. Representative Ortiz moves that the committee do adopt House Committee Amendment number 1 to House Bill 5225. All those in favor say aye, opposed say nay. In the opinion of the chair, the ayes have it, and the amendment is adopted. Thank you, Representative. And we also have some housekeeping, 142 proponents, including a variety of individuals on behalf of themselves, school districts, and universities. We also have 9 opponents, including the Illinois chapter, American Academy of Pediatrics, and then 3 in opposition, including Dan Lewis on behalf of DFPR and 2 other individuals. That Representative Manley, do we have individuals who want to give some brief testimony?
I do want to say also, for the record, we have another amendment coming. I think we've almost got it right in that amendment. And also, I wanted to say that this work is ongoing and how much I appreciate the Illinois Association of Pediatrics, and we will continue to work with them. They have my commitment to do that. I think we're on the verge of helping solve maybe we keep failing children in the state of Illinois every day. And the sooner they are able to get services, the more likely their outcomes are. So with that, I'm going to introduce Meg Roberts.
Good morning. Thank you, Chair. Okay. Thank you, Chair Morgan. Okay. Thank you, Chair Morgan, and my pleasure, committee, to be here today. What Rep. Manley referred to as what we call the autism waitlist crisis. Families wait 2 to 3 years to receive an autism evaluation. This is very problematic because 80% of brain development happens during the first 3 years of life. So children are missing out on intervention during a very critical period of their development. The wait is so long is because there are very few clinicians who are authorized and qualified to diagnose autism. There are only 23 developmental and behavioral pediatricians in the entire state of Illinois, but there are 300,000 children with developmental delays who need continuative care from these 23 pediatricians. So that's 1 physician per 13,000 children. These wait lists are why we started the Reduce the Wait research study. In this study, we wanted to say, you know what? Are there other clinicians who could be as accurate as specialists in diagnosing autism? So in the largest diagnostic trial of autism in toddlers in the history of the United States, we tested 639 children in Illinois, and we compared speech-language pathologists to expert diagnosticians, and we found that they were 93% accurate at diagnosing autism. In comparison, in a 2023 study by Keene et al., who compared general pediatricians to specialists, they were 81% accurate. So the data from this study tells us that SLPs are accurate diagnosing autism. The goal of this bill is to build a system so that in Illinois, children with autism don't have to wait for diagnosis. There are many solutions to this problem. The solution that this bill proposes is unique in 3 special ways. 1, it's based on data. 2, it's cost neutral. And 3, it is feasible to be implemented. Thank you for your time.
Thank you for your testimony. Yeah, please.
Thanks, Chair Morgan. Jonathan Dostler from Start Early. I just wanted to make 2 quick comments. One is that House Amendment 2, which is in rules, which was filed this week, is our latest attempt to try to get as many of our friends and colleagues to neutral on this proposal as possible. It is, in conversation with the Medical Society, they are neutral on House Amendment 2. We are hopeful that we can get to a good place with those interested parties. The second thing I wanted to mention is that we had a conversation with our new Department of Early Childhood yesterday. They had some questions about the language in our amendments around rulemaking, and we are open to figuring out the exact right way that they'd like that rulemaking language to be written. So just wanted to state those things for the record. Thanks.
Thank you, Jonathan. So it sounds as though we're on House Committee Amendment 2 that's in rules, but we anticipate a third, and we'll be coming back to this committee. Thank you. Thank you, Representative Manley.
Yes to everything.
Further discussion or questions from the committee? We have Dr. Jacobs.
Thank you, Chair. This is not adversarial. This is just an education, okay? It's been shown that 57% increase in diagnosis of autism in the last 4 years. Indiana is spending $340,000 in Medicaid for each one of their diagnoses. Are we overdiagnosing? Are we accurately diagnosing? I'm a little concerned. I'm very concerned.
Thank you for your question.
That is for anybody.
Yes.
Okay. Meg's next.
Here's how I would describe it. I'm not an expert in the increased prevalence rate. I'm a clinical trialist, so but this is how I view the problem. Imagine you look up at the sky and you look at the stars, and you think, oh, there are a few stars. And now you use a telescope, and now you're looking at the sky, and now all of a sudden you think, oh my gosh, there are so many more stars. It's not that all of a sudden we had more stars, it's just that we had better tools, so we're able to see the stars better. We have better tools now, and so we're able to pick up and diagnose characteristics in autism that we weren't able to before.
May I answer that a little bit as well from somebody
please.
who lives this?
Yeah, you do. Please.
When you think of autism, you think of, at least I thought of prior to my grandson being diagnosed. When you think of autism, you think of somebody severe, maybe nonverbal, difficult for them to function in society, difficult for them to go to school. Autism, if you know one person with autism, you know one person with autism. Sometimes, many times, these early intervention services make all the difference. I'm telling you that my grandson was not part of an early intervention plan. He was born just before COVID, and so those resources were not available to him. He is struggling, and he is on the low end of the spectrum. It is heartbreaking for my family to know that he could have, maybe he could be in a mainstream classroom right now. I mean, he's brilliant. He has behavioral issues that they could have worked on, but he was already 4 years old by the time we knew that he had autism. And he's progressed. He's gotten his ABA services. He's been on a medication. All this has improved his condition. But where would we have been if we had gotten these services early, when maybe his brain could have been reached by a therapist early to help mold him so that he could sit next to someone and not be bothered by the closeness, or that the lights or the sounds, things like that. So where he could control his anger better. And so getting them in line for services, even if it's a month sooner, makes a huge difference. When you think of autism, you cannot just visualize the most severe case. It's a spectrum for a reason. Everyone is different. And the fact that we could do something to improve the outcome and the overall life of that child, person, we should do that.
It still boils down, though, when you are diagnosing, it's a little bit different, to the person doing the diagnosing. There's no box that you're going to check necessarily, or equipment that you can test with. I know that there was a bill that I've been involved with that there's some speculation that color vision, if you can get them at 1 year old, 2 years old, 3 years old, would be really good. But as an eye doctor, there are no color vision tests that you can utilize, and they're trying to pass a bill that would do that. But I mean, I have been able to do 2 years old, 3-year-olds with certain tests, but 46 years of practice, I'm pretty good at it. So, I don't know if everybody's going to be all that good at doing the diagnosis.
Well, it's a process as well. But your question was, why are there so many more kids?
Yes, and I like the stars. That was good.
All right, we'll go with the stars. We'll go with that. But
yeah.
But think of it as, I'm going to say there are some people on the spectrum in this room.
Yeah.
Probably several. So they all are different, and their sensitivities, their issues are all different. And because science is so much better than it used to be, and we learn every year about this very complex condition, strike that word disease, it's a condition. It's not curable, it's the development of a brain. We're understanding it better. Science really does matter, doesn't it?
Real science does matter.
Real science does matter.
Thank you very much.
Thank you, Dr. Jacobs.
Thank you, Chair.
Spokesman Howder.
Yeah, thank you, Chair. So, just picking up on what Dr. Jacobs said, there's no doubt there's been a lot of abuse with the diagnosis of autism. So it's something that I believe that if we expand the diagnosing field, that we're going to also have again, more abuse. I'm not trying to be offensive, but there is severe abuse in the autism diagnosis. So I'm just like, will SLPs also be doing the therapy, and so they're able to diagnose and initiate the therapy, and for how long, and is this a lucrative?
I share your concerns. I think there is a conflict of interest. I think the people who are diagnosing serve to benefit from the revenue they're going to generate. What is unique about this proposal is that this diagnosis would occur within the early intervention system by early intervention providers. Those people don't run ABA clinics. Those people don't have that shared interest, so that if you diagnose it, it doesn't actually change the amount of EI services they get. It changes the amount of services you can access through their health insurance. So in some ways, this is even less likely to lead to those conflict of interest because it is working outside of the system.
Okay, well, that's good. That's good to hear. So thank you again for all the work you've done with the Med Society. I know when the physicians hear somebody else is going to do any kind of diagnosis, they get stressed out. So thank you for all the work you've done, worked on making sure that there is some, and I think that when it comes back on second, that there will be some accountability with a physician oversight in the diagnosis so that it's confirmed. So we could almost call it a tentative diagnosis, that we can initiate therapy, but there will be, I assume that's what you're working on. Okay.
Just one comment. There is not necessarily confirmation from a physician in the amendment that the Med Society is neutral on. There is referrals to physicians for continuity of care once an autism diagnosis is achieved. And so,
yeah. So there'll be some point where a physician is involved.
Always.
Okay. Thank you.
Thanks, Spokesman. Vice Chair Ma.
Thank you. I wanted to thank you for bringing this bill. This is incredibly important work. I became aware of the shortage from speaking to a researcher who'd been helping a social service organization in my district that has a support group for parents, families with children with autism. And what she made me acutely aware of, as a result of this bottleneck in services, it's something that disproportionately affects low-income families and especially immigrant families. And so, this is just really important, something that I'm grateful to you for working on, and I would love to be added as a sponsor of the bill.
Will do. I like to use this line when people ask me why. My grandson's almost 7, so nothing we do here today is really going to help him. We've done what we could do with what was available. But once you see something, you can't unsee it. And it's a wrong we need to correct here in the state of Illinois. And access to diagnosis, access to services is part of that huge mountain that families are trying to claw their way up. And so I would appreciate, and I will add you to the bill. Thank you.
All right, there being no further discussion, Vice Chair Ma moves that House Bill 5225 do pass as amended. Is there leave?
Leave.
Thank you, Spokesman. With leave, there are 14 votes in favor, 0 voting opposed, and 0 voting present. House Bill 5225 is declared passed as amended and will be favorably reported to the House floor with the commitment from the sponsor to bring this back with an even better amendment. Thank you for your work on this, Representative. We are next going to move on to Representative Yang Rohr with House Bill 4698.
Thank you, Mr. Chair. House Bill 4698, this is one of the bills where I'm asking for the committee support in passing and holding on second. We do have an amendment coming that I believe will bring parties to neutral, but I will just here take the chance to maybe describe what we're trying to do, the issue we're trying to address. So essentially, this is addressing situations where our constituents find themselves unexpectedly charged for multiple doctor's office visits from one office visit. This is generally happening during an annual physical or a well checkup, which are preventative visits. But what my constituent found, where the constituent who initially brought this to me, was that when he was asking like certain follow-up questions or a question about a mole or about like an antibiotic prescription that he had, that what happened was that triggered something in the system that made it now a new office visit, and he was charged accordingly for that additional visit. So I think as a group here, we can understand both sides of this. So for the patient, they're just legitimately asking a question about their overall health, and you should be able to ask those questions. But for the doctor, the visit goes from being a preventative visit to a diagnostic visit, and results in a whole different office visit. But for them, they don't necessarily want that patient to go, or no one really wants that patient to go and schedule a whole other office visit. And so it is efficient to handle all that in that one visit. And so this bill and the amendment that we're working on would essentially to address some of these situations, to take away some of that confusion, and it will the amendment that is coming, and you'll be able to see like what the specific language says, will basically require a posting of information saying like if you ask certain questions, it might make this preventative visit into a diagnostic visit, and you'll be charged for two. So it's more of an informational posting.
And thank you, Representative. My understanding is there's no opposition to this. We're just going to restructure the location of this language into a different portion of the state statute. Is that correct?
And there's also kind of specific suggested language for what the posting will say. Yeah.
All right. Thank you. Questions or discussions from committee? Spokesman Howder.
Thank you. So I'm surprised there's not opposition, because this is a common thing, and I don't necessarily agree with you calling it another visit. You're charged for another visit. We're just taking care of multiple problems, and we run into this all the time. Somebody comes in with, let's say an upper respiratory infection, and they also want you to deal with their back pain or their rash or something in addition that has nothing to do with the visit, but it does take effort and maybe another prescription. Is that what you're talking about? Multiple charges for multiple problems that are addressed?
So in this situation, so this was the annual wellness checkup, and so for my constituent who experienced this.
Excuse me. So this is just for annual preventative wellness checks. It's not for other visits for illnesses or.
Yes, the language that we have specifies that these are preventative wellness visits. And so in this situation for this constituent, for his insurance, it was completely covered and there would have been no cost. But what happened was, in his situation, he asked for his regular, he has a prescription for antibiotics, and he just asked, like, could you fill that prescription? And they did it. According to him, it took about a minute. But So getting that prescription, essentially what he found, like, maybe a month later, was that the insurance company paid for an additional office visit, and then he also had a copay now to pay. And so for him, he thought that he was just going for this one preventative service, but asking for that prescription, triggered, I guess, what was considered an additional office visit. And so we're not saying that shouldn't happen, but we just want to make sure that patients know that they're being charged.
All right. I understand. Thank you.
Thank you, Dr. Howder. Dr. Jacobs, for a quick follow-up.
Very brief, Chair, I promise. for instance, I see someone for their annual exam, and we find that they maybe are showing signs of glaucoma. When we change what we're going to do then, but we tell them as we're going along, this is going to be a charge, this is going to be a charge, this is going to be a charge. So I don't know how it's going to affect either. I guess I'm still trying to learn on what exactly you want to do.
No, what you're doing, I think, is exactly what we want to happen. I think we've talked to other patients where this has happened, where during that wellness checkup, they asked about a mole. And, the doctor, knowing that there would be another office visit, actually stopped the question and said, hey, if I answer this, it's going to be another office visit.
Okay.
Like, maybe we should stop, and then, because I'm going to send you to a dermatologist anyway, so this
Yeah.
way you won't be charged. So I think you're doing it exactly how we would.
Yeah, I mean,
what
we
want
may
the
do
state to
photos and a number of other things, and they're costly, but they're documented and going. So I guess I don't know the necessity of it, but
I think the necessity comes because our patients, our constituents, didn't know that
Yeah.
there was going to be another office visit charged. And so again, totally legitimate because those services are provided.
Yes.
We just don't want those surprises to come up.
okay. Thank you. Thank you, Chair.
Thanks, Dr. Jacobs. Any further questions or discussion from the committee? There being no further debate, Representative Ortiz moves that House Bill 4698 do pass. Is there leave?
Leave.
Thank you, spokesman with leave. There are 14 votes in favor, 0 voting opposed, 0 voting present. House Bill 4698 is declared passed and will be favorably reported to the House floor with the commitment that you're coming back with an amendment. Thank you, Representative. Next, we will move on to a triple header with Representative Cassidy, who has 3 bills for us, two new bills and 1 amendment. And we'll start with House Bill 5046. Representative, thank you for always being here.
Feel like I should just move in. House Bill 5046.
You're welcome to sub on anytime.
I am the super sub. House Bill 5046 is very much a work in progress, so I expect to be back with a different approach. This comes out of the work I've been doing with chronic pain patients and a challenge that pain patients often find in accessing their meds. Because of the way we handle those prescriptions, very often they're just trapped and not able to go to a different facility to get their meds because they can't transfer their prescription. I understand there's some tech issues involved that might be challenging, and so we are continuing to work both with the chronic pain community, which just wants access to their meds, and with IRMA and the Med Society to make sure that we do it in a way that's workable. So I anticipate that this will either be back with a functional amendment or we'll live to fight another day.
Thank you, Representative. We have 42 proponents, a variety of individuals, including She Votes Illinois as an association, 0 opponents and 0 no opposition. Any questions or discussions for the committee? There being no further debate, and with the commitment from the sponsor to hold on second, as discussed, we're going to go. Vice Chair Ma moves the House Bill 5046 to pass. Is there leave, spokesman? Leave, yes. Thank you. With leave, there are 14 votes in favor, 0 voting opposed, and 0 voting present. House Bill 5046 is declared passed and will be favorably reported to the House floor. And don't go anywhere, Representative, because we're going to move on to House Bill 5411. And I believe you want to adopt House Committee Amendment number 1. Is that correct?
I do.
Great. With that, we are going to have Vice Chair Ma moves that the committee do adopt House Committee Amendment number 1 to House Bill 5411. All those in favor say aye, opposed say nay. In the opinion of the chair, the ayes have it, and the amendment is adopted. Representative, please proceed.
Thank you very much. House Bill 5411 is another work in progress. The problem we are seeking to solve is the challenges animal rescues and shelters are having in sort of keeping up with workflow and making sure that they're able to give all of the animals in their care appropriate medical care. So just as we have done in the human healthcare space, we are contemplating ways that other professionals can participate in providing rabies vaccination and care. There's considerable gulf between the Veterinary Association and the shelter folks. So we're continuing those conversations. We got the conversations underway at kind of late in the game. So again, this is one that we're going to try to solve the problem without causing another one, and we will be bringing this back as well.
Thank you, Representative. And we do not have any proponents on the amendment at the moment, but as sponsor mentioned, she will be coming back with a second amendment that will address some of the concerns. We have 61 opponents, including the Illinois State Veterinary Medical Association and a variety of other individuals and clinics, and one opposition with Caitlin Mitchum from IML. With that, questions and discussions from committee. Representative Tisward.
Thanks, Chair Morgan. Representative, just so I understand this, so this is so animal shelter workers can vaccinate
the
animals. Is it only for rabies? Is it for more than
right now?
rabies?
It's just rabies because that's the one that has the most controls on it in terms of how of the provision of those vaccines.
Okay, so the workers in the facilities would be working under the direction of a vet who would allow them to do this.
Yes, not unlike we see in the human healthcare space where you've got a advanced practice nurse working under the supervision of a physician.
Okay, I take great interest in this. This is an issue I'm having back home with one of our facilities. I do think we're probably going to be partisan right now since there's an amendment coming, but I look forward to hearing what
I
it
would
is
love
and
to loop you in.
vote on the floor maybe different than I do
And if
today.
you want to participate in the conversations, I'd be delighted to have
I would like to do that because this
Great.
is an issue.
Thanks.
Thank you.
Thanks, Representative Tipsword. And also, before we go to spokesman, I know IDFPR has some questions, was hoping to amend some of the language about proposing rules versus adopting
and
rules.
the timeline piece as well. That's
right.
That will be that we've received that all
Great.
fine.
Thank you, Representative. Spokesman Howder.
So the vets are opposed.
Yes.
But it's giving them the opportunity to delegate it. It doesn't force them.
Exactly. And honestly, the shelter folks are asking, really only want it to be for shelters. They're not even asking that it happen in private facilities. So, I think there may be some concern that it would cut into a practice, but that's, the number of, and I don't know about y'all, but a lot of our shelters also have community clinics, low-cost clinics. They can't keep up. So the demand, I don't think that this is going to be a harm to somebody's practice because what we're dealing with is just the shelter volume.
Don't laugh at me, but can this be done by the vets observing via telehealth?
I don't know the answer to that, but that's part of the conversation, I think.
So
I would never dream of laughing at you.
Telehealth, rabies shots. If they can observe, because that's one of the things that they did tell me. They don't know that, but they're responsible for it. They're responsible for reporting, and they're responsible to the Department of Public Health, and they haven't seen it actually happen.
Right, and I think that again, the difference between a shelter environment and a practice where you've got like individual exam rooms is another piece of that puzzle, right? Like what are the practical considerations? And maybe telehealth is one of the ways to do it. I don't know.
Yeah. So okay, so if there's no who will be this delegating?
So the vet. So for example, the shelter
if they say
vet.
no, I'm not going.
Then it wouldn't happen.
Okay. So you wouldn't doctor shop for somebody up in Chicago is doing the whole state under their license.
That is not the intention. The intention is, for example, there's a facility in my district called Treehouse Animal Shelter. It's a cat shelter with an attached community clinic. There is one vet in charge of the facility. They, it's a big space. It's not like little exam rooms, and so he would be present in that circumstance.
Yeah. Okay. Thank you.
Thank you.
Thank you, Spokesman. Further questions or discussion from the committee? And let's add Representative Schmidt back on the roll and remove temporary member Haas. And again, Representative, thank you for the commitment to hold this on second, bring it back, an amendment that this committee can adopt, but you'll be holding it until then.
I will indeed.
Thank you. There being no further testimony, Vice Chair Ma moves that House Bill 5411 do pass as amended. Representative Spokesman, is there a leave?
Partisan leave until we see the amendment.
All right, thanks, spokesman. With that, there are 9 votes in favor, 5 votes opposed, and 0 voting present. House Bill 5411 is declared passed as amended and will be favorably reported to the House floor. And third and final bill from Representative Cassidy, it's a House floor amendment number 2 to House Bill 4826. Representative, when you're ready.
Thank you. Pulling up one item. So this is the promised amendment that addressed the department's concerns. IDFPR requested language clarifying their role in this. So this eliminates any operational impacts and brings the department to neutral on the bill. I will say, right after our hearing, I actually did get. I was contacted by somebody who had filed a slip on the bill, who wanted to share her reason for supporting it. She's the Continuing Education Registrar and Legislative Committee Chair for the Illinois Dental Hygienists Association, and she, as the person who reviews and approves continuing education for the dental hygienists, wanted to share an example of something that she had actually encountered in her work. There are many states that allow dental hygienists to give, say, Botox injections. Illinois is not one of them. And so she has had people attempt to take training to be able to do it, but they would not be able to do it under their license. So that's the example she gave as one of the items that would be, y'all had asked for some real world examples, and it was kind of fun to have that land in my inbox minutes after asking. So just wanted to share that with y'all.
Thank you, Representative. And while we only have one, for the House Amendment number 2, we have 1 proponent and 2 in opposition. Jerry Johnson as a proponent, and then for the opposition, we have both IDFPR Dan Lewis, but also the underlying bill still had and still continues to have proponents, including NASW and the Illinois Dental Hygienists Association. Is that right, Representative?
Yes.
Great. Any further discussions or questions of the committee? Dr. Jacobs.
Back to the dental hygienist and Botox. They want them to do Botox?
No. So there are several states that allow it.
Okay.
They have not sought the ability to do so. Illinois does not allow it, and they have had people attempt to use continuing education credits to go to classes to learn how to do it, even though they would not be allowed to do it under Illinois law.
Okay. But still would count as a continuing ed in that case, I would imagine.
Currently, yes, but under this, it would not.
Okay. Okay. Thank you.
Yeah,
Thank you, Chair.
this would prevent that from being a continuing education credit.
Thank you, Dr. Jacobs. Further questions from the committee? There being no further discussion, Vice Chair Ma moves to recommend that House Floor Amendment number 2 be adopted. Spokesman, is there leave?
Partisan.
All right, with partisan leave, there are 9 votes in favor, 5 voting opposed, and 0 voting present. House Floor Amendment number 2 to House Bill 4826 will be recommended for adoption and favorably reported to the House floor.
Thank you all very much.
We're going to put Vice Chair Ma in the chair.
Vice Chair Ma in the chair. The chair recognizes Chair Morgan to present House Bill 5387 and House Committee Amendment number 1 to House Bill 5387. Representative Morgan moves that the committee do adopt House Committee Amendment number 1 to House Bill 5387. All those in favor say aye, opposed say nay. In the opinion of the chair, the ayes have it, and the amendment is adopted. Chair Morgan.
Thank you, Vice Chair Ma. So this is an omnibus from the department that cleans up a variety of sunsets and acts. We heard from a variety of different stakeholders, mostly technical amendments, nothing substantive to discuss, but we do have the department here to answer any questions, and I ask for your adoption.
Okay, before moving forward, let me just read the witness slips into the record. We have 3 proponents, 0 opponents, 0 no position, and among the proponents, we have IDFPR, and then we have Karen Caffey from the Illinois Association of Marriage and Family Therapists. Okay, so do you have any witnesses here to testify?
Vice Chair, just the department here for any questions.
Are there any questions from members? Representative Tipsworth.
Thank you, Vice Chair. Chair, I really don't see a lot in here that I'm concerned about, other than it looks like in boxing and mixed martial arts, we're dropping mixed martial arts and it's just going to be boxing. Am I reading that right?
I don't believe so. Sorry, Dan Lewis, IDFPR. I don't think that's the case in the bill, but I'll have to double check. It's supposed to all just be technical changes, so I don't think we're dropping martial arts.
Okay, as I read through it, it kind of looked like
There's
we
some
were.
changes with the types of licenses and everything, but that's our legal folks are working on it, and it's a little bit over my head.
That's
but
not the intent,
No,
though.
I don't think that's the intent. No.
Okay. All right, thank you.
Thank you.
Okay, spokesperson Howder.
Thank you, Chair. This bill wore me out. So I'm going to ask, is there any major changes? Is this all just sunsetting? You didn't slip a tax increase in here or anything like that? 'Cause
Not this time.
Okay.
No, no, there's nothing crazy in
No,
there.
it's just
nothing-
all sunsetting
nothing-
and-
It's technical changes, making sure our acts have similar language to each other. You know, we do this every 5 years for all these acts now. So, modern language modernizations, gender neutral language, that sort of thing.
Okay. So you did the gender neutral language stuff. Okay. And give me an example of that.
Turning, you know, it might say he referencing a licensee or an applicant. We might change that to they, or just say the licensee or the applicant.
Okay. All right, thanks.
Thank you.
Any other members seeking testimony, seeking comment? All right, there being no further testimony or debate, Representative Ortiz moves that House Bill 5387 do pass as amended. Is there leave?
Leave.
All right, leave being granted. There are 14 votes in favor, 0 votes opposed, 0 voting present. House Bill 5387 is declared passed as amended and will be favorably reported to the House floor. Chair Morgan back in the chair.
Thank you, Vice Chair. And committee, we're doing great. We have 2 more, at least 1, maybe 2 more that we're going to hit. We're going to move to Representative Deuter for House Floor Amendment number 1 to House Bill 4953. Representative, welcome back whenever you're ready.
Good morning, Chair Morgan and members of the committee. I hope that this is the fastest discussion that you will be having for your sake. This is House Bill 4953. This was passed by this committee unanimously a number of weeks ago. At the time we mentioned that we had an amendment coming. It did not get assigned to this committee in time to be heard when we brought the bill. So we are back with a floor amendment. And what it does, which we mentioned previously, just makes it absolutely explicit that nothing that's being changed by this bill would apply to controlled substances. Happy to answer questions. Appreciate the support.
Thank you, Representative. We have 1 proponent, Dave Sullivan, on behalf of Patters Companies, and 1 opposition from Dan Lewis on behalf of IDFPR. Are there questions or discussions from the committee? Seeing no discussion, Vice Chair Ma moves that to recommend House Floor Amendment number 2 to House Bill 4953 be adopted. Spokesman, is there leave?
Leave.
Thank you. With leave, there are 14 votes in favor, 0 voting opposed, and 0 voting present. House Floor Amendment 2 to House Bill 4953 will be recommended for adoption and favorably reported to the House floor.
Thank you very much.
Thank you, Representative. And we will stand at ease for just a moment for our last and final. All right, we are going to put Vice Chair Ma in the chair.
Okay, Vice Chair Ma in the chair. Chair recognizes Representative Morgan to present House Bill 4977.
Thank you, Vice Chair. Happy to present House Bill 4977 on behalf of Representative Grassi. This bill, and we have Greg Willis here from IDPH to give details, but it really deals with epidemiology and what a hospital must do and take into consideration. I think most of this is driven by changes from the federal CMS and changes at the federal level about recommendations for hospitals, in particular to implement a comprehensive intervention to prevent and control pathogens of epidemiological concern instead of a multi-drug resistant organism, MRSA, which I think about a decade ago kind of became the standard, and we've, of course, evolved since then for all the obvious reasons. I know of no opposition, and if there are any questions, I know Mr. Wells is here to answer them.
Okay, before we get to questions, let me just read the witness slips into the record. We have 3 proponents, 0 opponents, 1 no position. Of the proponents, we have Greg Willis on behalf of IDPH, Allison Sledz on behalf of Lurie Children's Hospital, and Greg Willis on behalf of IDPH. The 1 no position, Dave Gross on behalf of the Illinois Health and Hospital Association. Mr. Willis, did you want to present testimony?
Thank you, Vice Chair. I'm just here to answer any questions.
Okay. Are there any questions from the committee? Okay, Spokesperson Howder.
Thank you, Chair. So it just seems like this is just busy work and bureaucracy for hospitals and doesn't really do anything. Hospitals currently do this. It changes the name to pathogens of epidemiological concern and then requires them to file all kinds of new paperwork on the name change. Am I accurate saying that, or is that?
Thank you for your question, Dr. Howder. I wouldn't say that's necessarily accurate. What it does is, though, it will require the like intensive care units each at hospitals and other facilities to provide their own. So the MRSA, the previous bill, the way it's in statute, the MRSA Screening and Reporting Act, it basically addresses MRSA only. What this does is broaden the scope. The MRSA is kind of, it's not a high level pathogen in the current state of the medical. So certain different, and you can probably attest to this, certain different units, like a burn unit, will have a different standard of trying to keep pathogens out of that ward or unit versus maybe, an infant type of facility or ward. So what this bill does is, let me just read from my script. Or what it does basically is it allows the hospital unit to specify what's the most important MRDO, and therefore create a pathway to ensure that they're most protected. So it's real specified.
Spokesman, I'll jump in real quick. I believe, and IDPH can correct me if I'm wrong, I think the conditions of participation at the federal level have evolved, specifically including this language. Because again, I think about a decade ago, the COPs at the federal level specifically required MRSA policies and protocols and trainings, and I think it's evolved to specifically use this language. So I think this is, my understanding, IDPH can correct me if I'm wrong, I think this is just matching up what we are getting from Medicare and what hospitals, Dr. Howder, as you're alluding to, federal requirements already require, but state laws have not been amended and modernized.
Okay, that makes more sense. I just don't want to, we have policies, protocols coming out of our ears, and now this does a name change, but if you're telling me that it complies, it more closely complies with federal regulations, I can understand that. I just don't want us making a law to change things that we do all day, every day. We address these pathogens, and now you're telling us that we have to have a policy, which we already have. And I just want to make sure that's not happening with this bill.
Understood, and that's not the intent of the bill. It's just to more effectively capture more modern pathogens, whereas the previous statute that we have, like the chairperson said, needs to catch up with more widespread federal regulations on it.
Okay, and Chair, I did not hear if this was coming back at all, but
I do not believe there's an amendment on this, no.
Are there any other questions from members? All right, seeing none, there being no further testimony or debate, Representative Manley moves that House Bill 4977 do pass. Is there leave? All right, leave being granted. There are 14 votes in favor, 0 votes opposed, 0 voting present. House Bill 4977 is declared passed and will be favorably reported to the House floor. Chair Morgan back in the chair.
Thanks so much, Vice Chair. Thanks, committee. Again, rockstar action here. We do not currently plan to reconvene this week, but as always, anything could happen. But just so you know, expectations-wise, I don't think that we will have to reconvene. But of course, if we do, we'll let everyone know. There being no further business, the House Healthcare License Committee shall recess to the call of the chair.